2024, and you should be at the Managed Care Data Quality Monitoring webinar for Encounter Data. And we're going to be talking about Encounter Data Validation Testing today. So I will let a couple minutes go. We're seeing quite a rise in the numbers of people joining right now. So I will go mute for a little bit and let that kind of flesh out. We know folks are coming in and joining us in the first couple minutes anyway. So go grab a coffee. We'll be right back. Okay, it's still going up. Oh, it is still going up. We're still seeing people joining. I hope you had a very pleasant, if solemn, Memorial Day weekend. But we are moving straight into the work week here at DHCS, and this is going to be about an hour to an hour and 20 minutes today. I think we've reserved about 90 minutes for it, and we should have some time left for questions. Still seeing people join, so thank you everyone for coming on for this topic. I'm going to start now. It's 10:03. So Abby, next slide, please. Hi, I'm Amy Peterson. I'm the section chief that over the section that is producing this particular webinar series. And we have gone through an entire year of managed care data and county data and behavioral health and 274 data and all of the introduction to it and what to expect. And this year, I think we're going to be going into more detail, subtopics, categorizing some of the issues in better ways, more informative, and try to really meet a lot of needs. We plan to do a survey. It's in the process. And try to get an idea of what people really need from this webinar series for staff and for interaction with DHCS and understanding how to make it more robust and more resourceful for everyone using the data and everyone submitting data. So the agenda today is specific to DHCS encounter data, and it's data validation testing. We have a whole crew here to talk to you about that, and warm welcome to all of them. We're also going to be talking about enhanced care management, community supports, comprehensive care management, and the JavaScript object notation, which is JSON. You'll hear that anecdotally as JSON, and it's the ECMCS ECM JSON exchange. So we'll be having someone speak to that as well. And then we'll go over communication and resources planning what comes next after that. So today's speakers are myself, Christine Fessler, Stephen Lefebvre, Constantine Chiokina, and Jeff Jennings. So welcome to all of those speakers. That's quite a few, and they have a jam-packed session for you. Our support team is Abby Geber-Selassie. I can't believe I did that. Abby Geber-Selassie and Mei Shan Eng and Samantha Van and Xiaoyan Ma, who has joined our team, and Sujung Kim, who leads that whole team and brings it all together for us. Next slide, please. For general questions, please submit your question to the WebEx chat. We're going to be monitoring. We got a few people monitoring that today. And please ensure that your questions are visible to all participants, because nobody who's actually speaking or running this is looking at the chat. So we need you to go ahead and put it in the all access chat. Don't send private messages, please. For specific questions, please reach out to the appropriate data mailbox. We'll instruct on where those are and who those are and where they belong at the end of this webinar presentation. So as will be instructed closer to the end of this presentation, there'll be a few intertwined as well. All of the links when we post this webinar series online, and it is posted online pretty much 2 weeks after the presentation happens, all of the links will be live. So for the first part of this presentation, we're going to be talking up to the DHCS Encounter Validation Testing Team, the Data Quality Reporting Unit. And I believe Christine Fessler is the unit chief who will be speaking to us, and she's going to go over the purpose and roles and responsibilities. So here we go. Welcome, Christine.
Thank you. Hope everybody can hear me okay. I would like to thank you again for your time to attend the data qualities discussion on encounter data validation testing. So just the genesis of this presentation really arose from the staff on the data quality reporting unit team who really had the desire to assist the healthcare plans in better understanding the validation testing process, and then to also add to the information resources available on the Data Quality Webinar Series webpage that Amy Peterson and her team have done a wonderful job compiling and managing as a resource for healthcare plans. All right, so let's see. Again, we've already introduced. Hello, this is my first time presenting in this webinar series. Usually Debbie Dixon presents, and she makes it look very easy. So I'm a bit nervous, so thank you for bearing with me. I am the unit chief of the Data Quality Reporting Unit, and joining me today are the two Encounter SMEs, Stephen Lefebvre. Many of you may have worked with him previously, and so I'm very happy and pleased to work with him in the Data Quality Reporting Unit and recognize his generosity in sharing his knowledge and experience on encounter data validation testing. Another one of the fantastic encounter data specialists is Constantine Chiokina. Over to DHCS, he's quickly gained encounter data knowledge and has led the efforts to streamline the encounter data testing process. So as Amy said, I'm going to provide a brief overview of the who's and whys of encounter data validation testing, and then Stephen and Constantine will go into further details around the testing process and data quality's role in helping the healthcare plans to get quality data. All right, so Amy's already got the slide up there. So the purpose of validation testing, it really kicks off from two events. One of them would be existing healthcare plans that are expected to undergo or are currently undergoing major systems changes. this does require a retest of the new system to ensure there's not going to be any impact to the quality of the encounter data that the healthcare plans are submitting to DHCS PACE's system. Another thing for existing healthcare plans, if they choose to contract with a third party to submit the encounter data files for them or make changes to who they're contracting, such as maybe healthcare plans begin contracting with Edifix to manage the encounter data submissions. So that would require retesting with that new vendor. Another one is a more obvious, new healthcare plans to Medi-cal. They've never submitted their data before to our system, so they will need to undergo encounter data validation testing just to make sure that they're aware of the various sort of encounter files that will be reviewed later on by Stephen Constantin for testing purposes. So there are many new PACE organizations that have been onboarding for 2024, and we welcome you and hope that this webinar will also assist in your understanding of the process and requirements. Okay, so why is testing needed? We want to make sure that the healthcare plans are submitting files and data, encounter data, that meet the DHCS data quality dimensions. I'm sure you've heard in the prior webinars, they're often referred to as the CART dimensions, which is, completeness, accuracy, reasonableness, and timeliness of the data. We also want to make sure that any new and existing HCP files adhere to the X12 HIPAA compliance transaction guidelines. And then also why testing is needed is we want to make sure that the healthcare plan systems are ready for prime time, which for us, prime time is really the PACE's production server. All right, so if we could go to the next slide, please. All right, so roles and responsibilities. So for the encounter data validation testing, there are really three main parties here that are involved and key to a successful validation process, the validation testing process. So the first one that we have here, the healthcare plans. So the key thing that needs to kick off first is if it is a new healthcare plan, an existing healthcare plan that will have changes to that's responsible for submitting the encounter data files, they will need to share that contact information with the DHCS contract managers in order for the contract managers to fulfill the internal process request to get access of the healthcare plan contacts. We call them technical contacts, which again is we want to make sure that the technical contacts at the healthcare plan get the appropriate access to the PACE's test and production servers where they will be submitting the encounter data. One thing to note here is, especially maybe for the PACE organizations, is that if they are using a third-party vendor to submit the encounter data files, it might be a bit longer of a process and clarification around type of contact information that is required from that third party. And so that's just another thing to note. We want to get access done as soon as possible, because if you don't have access to the SFTP site, you obviously can't do the testing. So that's the important role there. All right, so the contract managers, they facilitate or liaison between the healthcare plans and the data quality reporting unit, which is myself and my team who will be presenting here. What they do is they share the healthcare plan technical staff contact information with a data quality reporting unit so that our team can kick off the conversations with the healthcare plan staff, which is, we introduce ourselves, we set up an initial meeting, we discuss testing needs, testing timeline, just, general conversations around that. And our goal is really to be there to provide support to the healthcare plan as they go through the testing process. We will also be validating the test files and communicating to the healthcare plan along the way, their scores, whether they pass or fail each of the validation testing phases. So, all right, if we could go to next slide, please. All right, so this again is just like the overview, again, of the main highlights of the steps that need to be done prior to commencing the encounter data validation testing. So again, main thing, the healthcare plans have to have appropriate access to the SFTP site. Some plans might have an automation aspect, which has to be especially if it's a systems change, that definitely has to be tested, and access needs to be set up appropriately. The contract managers, introduce the healthcare plans to our team. We get that contact information, and we reach out to the healthcare plan data quality reporting unit. So we'll discuss the test schedule, what the test criteria involves, any sort of documentation that is going to be required. And then, once parties agree on starting timeline of the test schedule, then we'll commence the encounter data validation testing. So with that overview in mind, I would like to hand it over to the very capable hands of Stephen Lefebvre, who will go into more detail of the DHCS PACES SFTP test server, as well as other test criteria for the validation testing. So thank you very much again for your time and attention.
And thank you, Christine. We are very happy to have Christine as an addition to the data quality reporting unit. We went without a manager for a long time after Julia departed, and Christine has really stepped in and helped refocus our unit and help us deal with some tremendous staffing shortages that we're having. So thank you. So if we can get started. So I'm going to be, my name is Stephen Lefebvre. I've worked with many of you over the years, and I've not had the pleasure of working with some of you. And there's also a whole slew of new plans onboarding that have not even met. So hello, again, Stephen Lefebvre. I've been with the Data Quality Reporting Unit for about 6 years now, and as this is such a huge project, but I'm very happy to be able to provide as much support as I can and have over the years. And so if we can go to the next slide, we're going to be talking about some of the details of validation testing, but also, encounter data in general. So the first thing I want to talk about is the PACES test server. So we have two servers. One is production. This is where actual encounter data is submitted, and for plans that have undergone testing and that are ongoing. There's also a test server that PACES maintains, and it mirrors the production server. It has all the same PACES edits, and it even stores its own test data. And and it looks very much like the production server, except it's called test. Prod is production, test is test. And then within the test folder, they're just like the production, there is a submit and a response. I believe it's called submit and response. And this is where you would submit your test files. And the response folder is where you pull your EVRs. And it works exactly the same way as a production server. So, a plan would, if a plan's in testing, it would upload a file to the PACES test server. The PACES system will retrieve that file, run it through its edits, and then it will upload a response file into the response folder. With the response file or EVR, they are going to look exactly like they do in production. So it mirrors the system exactly. It'll tell you, the response file will tell you whether the file was rejected or accepted. And if the file was accepted, then it will tell you encounters that were accepted or denied. And for the denials, it'll let you know exactly as the production does what the error codes are. And it basically gives you the details of those denied files so that you could use that information to correct the encounters. So that's kind of how it works. It's the same as the other. And if you look to the right, you'll see what the file path looks like. At least this is what it looks like in our systems. But if you're a tech person, then you'll recognize a file path in the top graphic and then the folders that it shows. And then the little box below it, that's kind of an excerpt of the response folder. And that's what the response file names look like. And the first part of it looks very much like the file name that you submitted. And then it does have extended information that provides information that we put in and tells you which response files are for which submitted files. Okay, so we can go to the next file, please. Next slide, please. So the test server, we also call it staging. It was created so that health plans can submit a file prior to submitting it to production, but also for validation testing. So, but say you're not in testing, you're just developing a file, you've been authorized to submit production, and you're not sure if that file is going to go through. Maybe you're doing some kind of new coding or checking out whether or not you picked the right procedure codes, or you're not sure about the duplicate logic or something. Then you can utilize that test server in order to see how that file will do. And if it goes through, then you know it'll go through in production because it's a mirrored system. We also use this for our testing. This is where we created this so you could submit your test files. It would go through the paces edits, and then we would run validation queries on those files to make sure that all the elements of the required in the test file are there, that there's accuracy, completeness, and reasonability in that data. So we found this really helps the plans with being able to check their files. And even prior to, when you're in the middle of testing, even prior to letting us know, hey, we submitted this test file and here are the results, you could even test your test file ahead of time on your own. Try to dial it in. If you get a file that doesn't really work right, or something's not right, or you're not sure about it, run it through the test on your own, look at the results. If it doesn't look right, fix it, then redo it, and then resubmit, and then let us know, hey, we submitted that file, we're confident that these are the results that we see, can you please validate that? So the test environment, we're not real strict with that. So yes, Jeff's talking about test sins. We'll be covering those in a little bit.
Yeah, sorry, Stephen. Okay. Not trying to step on your toes.
That's okay. So anyway, that's what the testing server is for. So if we can go to the next slide, please. Did we skip? Yeah, there we go. Something else that we're going to be providing you is companion guides. The companion guides are, the X12 is a national standard format. However, states require different types of information. There's customization there for each state. And for California, we capture that customization in what we call companion guides. Oh, it looks like we skipped a folder. Skipped a slide. While testing, let me rewind a little bit. While testing, we're going to be providing you with some testing materials and documents. This is to help you with to try to make the process seamless and easy. So we're going to provide you with something called testing criteria thresholds. This is a document that will provide all the standards for each type of file and each type of test file. And testing is a pass-fail. You either achieve the minimum threshold standards or you don't. And this document, I'm gonna show you what it looks like, and we're gonna kind of do a quick run through on it, and you'll see what I'm talking about. We're also going to be providing with a test tracker template. This is an Excel file, and it's a template. And it'll be part of your discussion process at the beginning of testing with your account data specialist. But primarily, this document is what we use to track file submissions. There's going to be a lot of back and forth communication. There's going to be multiple files being submitted by you, different types of files. And this helps us keep it straight. What file was submitted for what transaction, in what threshold, test criteria, and at what date, and the results of those files. So this template makes it easy for you to lay out all the information on your test files so that we're on the same page always. And Jeff was referring to test SINs. The term sin for some of you, this isn't like SIN, sin. Okay, so this is CIN, and it's short, it's an acronym for client index number. That's the Medi-cal number that beneficiaries are given. And so we provide a list of test SINs that the plan will use in the test files, and instead of real SINs. We try to minimize, for HIPAA compliance, we try to minimize the use of PHI, and it's just not necessary to put real SINs in test files. So we provide these so that you can replace them, and then we'll talk about those a little bit more. But we provide those test SINs, and then we provide the companion guides. And I already described the companion guides a little bit, but this is guidance for all encounter transaction types. There's multiple companion guides for each transaction type because they're all a little bit different. And this gives the particulars on the customization that California has done with their encounter data requirements. So if we can go to the next slide, please. Okay, so back to the companion guides. So like I said, customization, California, we are letting you know this is how we do it. This is how we do the X12. These are some of the rules that we've got in place. This is our duplicate logic. We follow this duplicate logic, so it helps you minimize duplication and file, encounter denials. So we have companion guides for 837 institutional. We have companion guides for 837 professional. They're very similar, those files, those types of transaction files. However, there are slight differences. There's different data requirements. There's different requirements regarding providers, attending physician, billing physician, that kind of thing, rendering physician. So they're different guides. Also for PACE organizations and for some specialty plans, they do submit NCPDP data to us the way the managed care plans used to. Managed care plans will not need these. Managed care plan, most major managed care plans, I'm talking the Anthem Blue Crosses, the LA Cares, the Health Nets, they're required to submit their NCPDP data to Medi-cal RX. And so we're kind of out of it. So these are primarily for PACEs. And even though they're called post-adjudication payer sheets, they're still our companion guides. Also dental. A lot of PACE plans provide dental. So we do have a companion guide for dental. And once you get your companion guides, I would recommend referencing them regularly. We're always available to help. We try really hard to keep up with all the plan questions. Sometimes, we get questions that they're pretty obvious. They're pretty easy to answer if the companion guide was just referenced. So this is a way for you to get a quicker answer. If you're not sure about duplicate logic, you could go into the companion guide, look up duplicates, and it'll let you know what the duplicate logic is. Sometimes, it depends on the workload of questions. If you're going to submit a question to us, then we're going to research it ourselves. If we can answer it right off the cuff, we will. If not, sometimes we do have to submit a ticket to PACEs. If it's something very technical to deal with specific type of coding, sometimes we need to actually go to the PACEs folks, PACEs team. So the companion guides are a way for you to research that issue yourself and see if you can answer that question yourself. So we really do recommend and encourage the use of the companion guides to help you with when you're building encounter files. Next slide, please. Next slide, please. Oh, somebody's asking about the latest versions. I don't have those in front of me. I'm sorry. They are in the documentation center, which is what I'm going to talk about right now. So we do periodically update the companion guides if there's some new PACES edit that will affect submission, or if there's some new guideline that's mandated by CMS, we will update the companion guides accordingly. So we used to send them out in an email blast. Hey, here's the new companion guide for this or that transaction type. But since we've gotten our fantastic new chief, Christine, she is really an expert on automation and also on record storage and access. So she has really helped us with this, and we're putting them now in the documentation center, which is also there's a lot of help there coming from Jeff Jennings, who's going to be speaking to you in a little bit. So the documentation center has all types of different documents that we're going to be talking about that can help you, and including the companion guides. The latest versions of the companion guides are directly uploaded to the documentation center by the data exchange people who develop and post them in this documentation center. So you can have them at any time. And there's a link once this webinar is published. You'll see the little blue letters that say documentation center. That's going to be a link that will send you exactly there. Or also, you can send a request to Jeff Jennings' group, dataexchange@dhcs.ca.gov, and they will provide you the information you need in order to access the documentation center so that you can make sure you have the latest versions of these and other documents. So next slide, please. So what happens after we provide you these documents? There's testing planning, or after we make initial contact. When you're a new plan, or even for an existing plan, we're going to have to discuss testing. So we plan it out. We don't just say, okay, we're going to do testing tomorrow, let's do it. And we actually plan it out. So once all the onboarding preliminary work is done with the managed care plan, all the contracts are accepted and all the information's exchanged, and the plan gets their staff to gain access to the SFTP sites and all that, the contract manager is going to forward your health plan contacts to one of us, either Christine, Constantine, or myself, the encounter data specialist and the manager. And what we're going to do is we're going to contact that health plan with the names on the list. And we're going to introduce ourselves. We're going to say who we are, what we do, and we're going to tell them we're here to help you with this endeavor. So part of that process is we're going to send you the documents, the test sins, the testing plan. We're going to email those to you, the tracking template. We're going to make sure that you're connected with the documentation center. And of course, we're going to make sure you have the companion guides. Then we're going to set a meeting to discuss these materials. We can answer any questions you have on the documents. I would recommend taking a look at them ahead of time, and then we'll discuss them individually. We'll tell you what they're for, specifically how to fill them out, what information can be gotten from them, and the nuts and bolts that we're not able to cover here for time. Then once that's all done and everybody's on the same page with how testing works and what all the materials are for, then we're going to set a schedule to start testing and the expected end date. So, and we try to keep testing within a few weeks to a month, up to 3 months. We believe that it can be done sooner than that, and we will do everything we can to help facilitate that. But we want to, we're going to have many plans. We're having a lot of new PACE plans come on board. We're going to be doing a lot of testing. So we're going to need to schedule them out so we know who's going to be testing and when. So that's part of the discussion. Starting testing the expected duration, and then the expected, and I shouldn't say expected as much as the hopeful ending date. And then we can establish when we're going to do it. Next slide, please. So the test criteria thresholds, we talked about those a little bit. We mentioned them, and I'm here to talk about them a little more detail. These thresholds, we call them thresholds. They are the thresholds for minimum standards is what they are, basically. This is, they're minimum standards that we expect the plan to be able to achieve in order to be confident that they will be able to submit quality data to us. And what's quality data? Well, it's reasonable data. It's enough encounters to cover what their services are. We need them all. It's the quality, the accuracy of the data. Are these accurate encounters? Also, to make sure that what it is that we want to test, which types of transactions, which types of encounters. So it includes all the transaction types. It includes encounter types, meaning I'll talk about those in a second, modifiers, and eventually, sample of production data. So it's kind of like a testing guide. It's the guide that we use to set the schedule and also the order of testing. So the next slide is going to show us, this is an actual excerpt of the test criteria threshold. Can we go to the next slide, please? This is an actual excerpt from, we have different ones. We have one for managed care plans. We also have a different test criteria document for PACE plans. And I believe this is the one, PACE plans, because it does include NCPDP in here. So, and if you see, we have them broken up into test cases and test criteria, Test criteria 1 is original encounters. Test criteria 2 is replacement encounters. Test criteria 3 is void encounters, and so on. The description, and it says what we're testing for. And a description shows the different types of encounter types, pharmacy, dental, long-term care. And then where it says threshold, the column with threshold, this says which file type, which transaction type, and what is the minimum standard for that test file. So for example, for 837I, it's basically saying that the file has to have at least 25 inpatient encounters, 25 outpatient encounters, and 25 long-term care encounters accepted. So, and you could very well submit an 837 file, an 837I file with 75 encounters. And if you and they all pass, then you pass that test criteria. However, there is usually denial. So there's nothing wrong with submitting some extras. If you want to submit 30 of each, and then if you do have some denials, and you can run these, like I said earlier, you can run these through the test server to make sure that they'll pass, and then you can say, hey, they passed. Or if they didn't, then you can not let us know yet that you're ready, and then refine the file so that you can let us know when they are ready for us to run them through validation testing. 837P, it's just 50 encounters, no encounter types. So one thing I do want to mention is at the bottom of each section, there's a little asterisk note that says an acceptance rate of at least 85% is required to pass. So, and the reason we put this was because, if you're going to submit an 837P file and you have to get 50 encounters in, you got to have 50 encounters pass, and you submit, say, 55, 60 encounters, that's great. And 50 pass, you passed, okay? However, we're trying to discourage, so, a plan could put 150 encounters in there. So hoping that 50 will pass. Well, that's not really a data quality, good data quality method. If you submit 150 encounters and only 50 pass, that's only a 33% acceptance rate. That doesn't really show well, and it doesn't let us know that you're really are submitting, good data. So we did add that little 85% as a caveat if you are going to submit extra encounters and you far exceed the minimum standard, that, well, we're going to want to see 85% then, which is far less than the actual encounter expected acceptance rate of 95%. So in testing, it's a little more lenient. So, okay. So anyway, so let's move on to, so test criteria 2, like I said, was replacements. Test criteria 3 is void. So can you void those encounters? Test criteria 2 is, can you replace those encounters successfully? Test criteria 3, can you void those encounters? Test criteria 4, and one thing I do want to mention also, if we can go back to the next slide, the previous slide. The first asterisk in that first test criteria 1 also talks about modifiers. We used to require a test file with just modifiers. And then we realized, well, they could put modifiers in these, so that we're trying to cut back on this. It used to be laborious. There was each test criteria had 3 phases with increasing rates. And we're talking, there was 20 files required, 25 files required. So this allows us to cut back on encounter submissions, on counter file submissions. So we're allowing plans to now pepper modifiers in there as well, because we can still run the modifier queries and look for those modifiers and make sure that they were submitted. So we have incorporated the modifier segment into the main body of test criteria. So, okay, next slide again. So test criteria 3, void. Test criteria 4 is compound drugs. This is only in the PACE plan and specialty plan testing. This is not going to be for the regular managed care plans. Test criteria 5 is PAD encounters. This is your administered drugs. This is in case the doctor gives like a vaccination or provides some kind of medication in office and the physician administered. And this is very important. We need to make sure that you can do this, because this directly relates to the 340B drug program. So we need to ensure that that data is accurate. So our capitated rates division, who processes the 340B drug program, has good data that they can do the reimbursements from. So that is a very important test criteria. And test criteria 6, this is going to be kind of a general test. Can the health plan submit a week's worth of production data in the test environment with minimal denials? And again, it's an 85% acceptance rate. And we want real production data. Just because you're not submitting encounter data, it doesn't mean you're not seeing patients. You're seeing patients. So what would be a week's worth of that encounter data? What would it look like? And again, with the test SINs, and Constantine's going to talk about those in a little bit, I believe. And what we really ask for is that you replace those real SINs in that production data with the test SINs. We're trying to minimize any type of HIPAA issues at all. And I don't know about you, I've been doing managed care for a long time, since basically before, right around the time that HIPAA was brought in the late 90s, with, I don't know what they called it, but Bill Clinton signed the healthcare bill, and HIPAA was kind of instituted then. I've been doing this since then, and I have no HIPAA violations. I don't want to have any HIPAA violations, and I don't think any of you do either. They could be very expensive, and it could get ugly. So I don't want CMS knocking on my door. So now let's talk about the tracker template. If we can go to the next slide. So the tracker template is put in the information from the test file and submit it to us. It's that simple, really. It can be a little more complicated in some ways. So, but every single time you submit a test file, we want a new tracker template with the new information in it. And it's cumulative. So it will just be a new version of the previous one. So it'll include the older information from the previous file. So we're just adding to it, adding the new files, adding to them down the list. And one of the most important parts of this is, in the file name, there's a date stamp. And that date stamp needs to be changed to reflect the date that the tracker template is submitted to us, not the date the file was submitted, unless it's the same date. We want the date that you're submitting the tracker template to us, the new updated version. So that date stamp needs to be checked. So the health plan will run their test file, they'll get their response file, they'll go into the tracker template, they'll fill out the tracker template, they'll put all the information from the EVR into the tracker template, they'll create a new date stamp, and then they'll send it to you. The plan will send it to your encounter data specialist, and they'll say, hey, we submitted a file, here are the results, here's the tracker template. This tells us, okay, now we need to do encounter data validation testing for that file. So this is how we keep track of everything and we keep the cadence going. So, and can we look at the next slide? Is going to be an excerpt from that tracker template. It's going to be an Excel file. And if you see the column submission month, that's the month you submitted it to us. The test case, this tells you which test criteria 1, 2, 3, etc. We talked about those. And then the thresholds, this kind of just briefly repeats the information that's in the testing criteria document. The submission date, what date was that file submitted? The health code, the health plan code, what plan? If you've got a whole bunch of health plan codes for your plan parent, we're probably going to negotiate with you. We're not going to require you to submit a file for every single plan code. If you've got 10 plan codes or even 3, we will probably just have you submit one for one health plan. And then the submitted file name. This is probably the most important column in this document. And we want the exact name of the file, including the extension, which will be, I believe, a DAT file. And this way we use that information, we input it into our validation queries that give us the results of your testing. It tells us if the file did in fact pass. There are subsequent columns to this document which we did not put in here, and that's just going to be the information from your EVR. How many transactions, how many encounters, how many were denied, how many were accepted, that kind of thing. You would fill in that information. And once that row is complete, then you would date stamp the tracker template. You would send it to us and say, we submit a new file, here are the results. It's very simple, and we will go over that with you. So, okay, so now I'm going to hand it off to my esteemed colleague, Konstantin Chachina. He is excellent. He's really great, and those of you who have him for your encounter data specialists are very fortunate. And so that concludes my portion. I'm still going to be available for questions or whatever. So thank you very much for your time. And Konstantin.
Thank you very much, Stephen. Thank you very much. Good morning, everyone. My name is Konstantin Chokina, and I'm Data Quality Reporting Unit. Next slide, please. So I will talk about test sins, client index numbers. So we will use test sins instead of the real sins, just to protect sensitive information. And the test sins will be used in all test files, 837i, 837p, dental, and pharmacy files as well. And if you don't have the test sins and you cannot find them in documentation center, then you have to contact us and we will provide that for you. Sometimes it could take a few weeks because we will have to collaborate with a different team who create these test sins for you. And after that, after we will receive them, we will send it to you and we can start the testing process. Next slide, please. Here is an example of the test sins and also how you will use them. You will create your test files and you have to use the test sins in all the files. And after that, you will submit to PACES via SFTP folder. Next slide, please. On this slide, how the process run for the validation. So basically, for the test criteria 1, you'll create a file, and you will submit that file via SFTP. And after you upload the test file, you will receive a response file. And from the response file, you will update the tracker template, which Stephen was talking about. And you will send that tracker to us, to me, Stephen, or Christine. And we will run the validation process, and we will analyze the information which you provide in the test file tracker. And if, let's say, your file failed, you had some errors, and if you have some errors, then you'll have to fix those, and you'll have to resubmit the file with a different file name. But if the file is good and you pass, you don't have any errors, it means you can proceed with the next test criteria. So, and this is the cycle you'll do for each test criteria. And after the test criteria 6, if you will submit it, and if the test criteria will be approved, the test criteria 6 will be approved, then you will get an informal email from us saying that you are approved to submit production files, and from that time on, you can submit production data to DHCS. Next slide, please. The timeframes, as Stephen mentioned before, the validation process can take up to 3 months. Usually, from our experience, it's much faster, but it depends. Sometimes the errors can be complex, and it requires more time to further research. So that's why we are really flexible on the timing. We can negotiate it and discuss, and in order to accommodate you with the time you need. You'll have to achieve the acceptance rate of 85% in case you submitted more encounters than the threshold, as Stephen mentioned before. Next slide, please. Questions. If you have general questions, please review the DHCS Managed Care Data Quality Monitoring frequently asked questions for your guidance. Also, if you have encounter data specific questions, then you can send those questions to our mail group box, which is mmcdencounter.data@dhsca.gov, and with a copy with your DQRU specialist. For technical questions, please submit those to edimdatasupport@dhsca.gov. Next slide, please. I think we'll discuss questions at the end of this presentation.
You are correct, Constantine. Yeah. Good job.
Thank you, Amy. Yeah.
Yeah, go ahead and put your questions in the chat, and folks will get to it. The presenters will get to them, or we'll take it back to subject matter experts, but that way we can get through the whole presentation. Thanks so much, Constantine, Stephen, and Christine. Next slide, please. And next up is Mr. Jeff Jennings. He is our Data Exchange Validation Unit Chief, and he will be talking to us about JSON Exchange. Here you go, sir.
Great, thank you. Hi, everybody. We'll do our best to provide as much information as possible about all these things that we're talking about. It is indeed complex. Medicaid data is complex, and the ways that various plans participating in Medicaid, some of the reporting has changed as the county behavioral health plans are aware, et cetera, et cetera. But don't worry, we are dedicated and committed to providing as much information as we can during this time of change and transition. And the one thing I will add before I get started is, as it's come up in chat, most of what we're sharing today is aimed at currently aimed at managed care plans. However, DHCS is working to integrate all Medicaid data and data reporting as much as it can be integrated. And so over time, what will happen is that whether you're a managed care plan or a behavioral health plan, much of the reporting is going to be very similar. Much of what we talk about right now does not yet apply to county behavioral health plans, but it will in the future. Some of the county plans use a different system for some of their reporting, et cetera, and those will all be addressed over time. So I just wanted to talk about that and address that at a high level, because I know the questions come up for every webinar as to who this applies to. So with that said, right now, managed care plans are being asked to start submitting data regarding ECM, CS, and CCM, extended care management, community supports, chronic care management, using a JSON formatted file. This replaces Excel templates that had been used in the past for this reporting. Moving to a digitized format allows us to better integrate data with as a whole and to have a better picture. And we think ultimately will help our trading partners as well. This using digitized data tends to be more convenient and smooth and so on. So this is one of the reporting bits of data, groups of data that we are now moving to a JSON file. So for managed care plan staff that have been involved so far, you are probably aware we've gone through phase 1, which was our introduction to using this file. We are now moving to phase 2. I'm going to share high-level information. Anything that's detailed will follow up outside of the meeting. One of the DHC staff persons who's been very involved in this and has kind of taken the lead is Janet Oto. She couldn't be with us today, so I'm kind of stepping in. So again, from a high level, for phase 2, the testing for the new schema, the new version of the file, will start in June. Production will start in August. We'll have more firm dates there. Just assume August 1st, June 1st for now. If any dates need to be changed, we'll let you know right away. In terms of resources, the ECM, CSCM technical guide is available in the documentation center. And you can think of the technical guide as being similar to both an implementation guide and a companion guide, and kind of gives an overall outline of how to structure the file. It has schema information, error information for the test, or I'm sorry, for the results file, etc. Also, we have a data dictionary that we're publishing, which goes over each element in the file and goes over that in detail. And then finally, the more technical specific questions can be sent to the EDM data support mailbox, and we monitor that on a daily basis. We'll get back to you right away in that for any questions that you send there. Next slide, please. Test sins, yes, okay. Test sins have been a thing. Now, test sins have been used by managed care plans that are submitting encounter data and to some degree provider data when needed, or ECM data to the PACES system. The reason we use test sins is to avoid any exposure of personal health information, anything that could be a potential HIPAA violation. The SIN numbers themselves are dummied. They are associated with a dummy member in our test environment. And this allows plans to submit test files and not have to deal with errors that they would be receiving if they had used actual production SINs, and to mainly just get past that SIN part of the validation. That's the primary reason that we use these test SINs. Test SINs look a lot like regular SINs, but as I said, are dummies. We used to email the test SINs out on request to each plan. We've taken a different tack. We are now posting them to the DHCS Documentation Center. Something to note about that is at the moment, because there is no sensitive PHI or other data, test SINs for each plan are posted to the folder shown on this slide. Please download the test SINs for your plan, for your HCP number. If you were to download test SINs for some other organization, you'd be using a different HCP, it would cause issues. So each set of test SINs is named with a plan name. And also, if you look in the file, has HCP numbers, you should be able to tell which is yours. If you do have any questions, the EDM data support mailbox is the place to send those questions. Next slide. So test files, PACES is set up with two parallel FTP directories, if you will. One is production, that's where the real actual production files go. The other directory is the test directory, as shown here, DHCS-PACES/test. That's the test directory, sometimes referred to as staging. Not only does the directory reflect production, but the code that is in test reflects production as well. So it's a very accurate testing environment. If you can pass a test in the test environment, your production files should be fine. And just like in production, response files are generated for test files and are posted to the test directory, the response directory shown on the slide. Next slide, please. Just to repeat, please restrict the use of actual member SINs to the production environment. If you use a test SIN in the production environment, it won't be found and you'll receive an error. So something to keep in mind with SINs, production, actual member SINs used in production files, test SINs used only in test files. To repeat about the directories, please go back real quick. Thanks. While I beat this up, thank you very much. Again, submit your production files to the production directory that's shown there. You can also see technical documentation, et cetera, and you can always ask us questions at the EDM data support mailbox. Okay, next slide now. Thank you. So validation response file, that is what we issue for the ECM/CS CCM file into the test response folder. Those will contain error messages, error or warning messages, with some references to the error message number itself and to the point in the file where this happened so that you can pinpoint it and track it down. Error explanations are available in the technical documentation. And again, something to pay attention to is the file naming conventions, which are also outlined in section 4 of the ECM technical documentation. And for any plans that are experienced, file naming conventions are in every companion guide or every technical guide, and go over how to specifically name your file. That applies to both test and production. Next slide. So this is a little tricky, but I think it should work fine. Starting in August of 2024, any phase 1 data, any data that was generated or collected, or is that is from the phase 1 time frame, will need to be resubmitted in the phase 2 format. And that format is outlined in the new schema. We also give you a phase 2 example of how to do that in the technical documentation. And just again, something to keep in mind. Inevitably, sometimes it takes more than one try, and we just want to emphasize that the mailbox is monitored constantly, and that's where to send your questions regarding mysterious test results or questions about submitting phase 1 data in phase 2. Next slide. Questions. As we've said, we are going to really dive into those questions at the end of the webinar. I think we've got a little bit more to share, and then we'll go ahead and take a look at the questions. So thank you very much. And as always, it's a pleasure to work with our trading partners. Folks are wonderful professionals. Thank you so much.
Thank you very much, Jeff. Yes, we will definitely be having a quick question and answer session. We'll go over some of the questions in the chat, and then if those questions and answers trigger more questions, we'll collect those. We'll get back to you. At some point, you will have an answer to your question. We're not ignoring those, but we will try to get through this piece very quickly so that we can go right to the question and answer session. So I just wanted to briefly go over communication resources. As I've said before, all of the live links in this presentation will be clickable. You'll have a PDF that you can hit. There will be a transcript, and hopefully it is genuine and clear for everyone. I know that sometimes they come out a little bit funky, but we will try our best to make sure that if you need it, we can make sure that you have more information. The data group mailboxes, you'll see that these are all going to be clickable and live links that you can use for your contacts communication. There's 274 medical, there's 274 behavioral health, there's 274 dental. All of those have different emails. There's behavioral health short Doyle has MEDCCC at dhcs.ca.gov, and counter data is MMCD encounter. If you click the wrong one, they'll get it to the right one, but go ahead and put your contact information and your urgent message if it's urgent, and it'll pop right up to their box. So DHCS Documentation Center access requests, a lot of us have permission to go ahead and add you. It is a public site, but we do want to know who's coming in and looking at things. So go ahead and hit that data exchange, or go ahead and hit the link that was posted by Shayan in the chat, and that will take you directly to it, and somebody will give you access very quickly. Technical questions, please, for the ECMCS and CCM JSON exchange, go to the EDM data support team, and anything related to this webinar, questions, suggestions for topics, anything like follow up, where is all the stuff? Why isn't it published? Whatever. You can go to us at MCDSS webinar support, and it's mcdss@dhcs.ca.gov. Again, mark it urgent if you need to. The webinar itself is loaded with information. Next slide, please. So that webinar series webpage is, we are just every day thinking of ways to make this better and better for plans and counties and behavioral health plans, and pretty much anybody who's submitting data or needs some information or quick training, or just even like a glossary page of all of the different acronyms. This is where you can go. So the quality measures and reporting page, all the things that you're already reporting, the quality webinar series has a link, and it has a link to the data documentation center. It has a link to a glossary. It has a link to different emails. It has an FAQ page. So all of those questions that you're asking in the chat right now, those will go to FAQ if they are deemed relevant for everyone, even if we have to kind of condense it and consolidate. But some of those you'll be able to go to it and say, oh, that's where my answer is. So next slide, please. This is the actual web page. So when you click on the quality webinar monitoring page, you can go back and forth between the reporting page and this resource page. And so again, all of those recording and the script will be published. The PowerPoint slide deck will be published, upcoming webinar schedule, and we may tweak the topic. So last year at this, around this time, or maybe even a little bit later, I believe Stephen did the encounters presentation. So you can go back and look at some of the common errors that come in and see how to improve your submissions. And then this one was really focused on the validation process and what is done here at DHCS and how we can help you help yourselves. And
Amy?
Yep.
Can I cut in really quickly? I just wanted to
Absolutely,
add
go
that
ahead.
those frequently asked questions, this is a dynamic list that's going to continue to grow. As we find more questions coming in from plans, we're looking at the questions from plans. And when we see things that are common themes, we're going to be adding them to this list. So
Exactly.
this list has literally just started. So
it's been all year, but we
yeah,
do
it's
keep
been
adding
just-
to the topics.
we're going to be adding to this forever. And
Yep.
hopefully plans will be able to go in there and answer their questions without having to wait for an answer. They can get an immediate answer. So I just wanted to add that.
Yeah, we are trying very hard to make it easy technical assistance and accessible and very robust. Like Stephen was saying, it's going to keep going. It's a living document. Next slide, please. Okay, so where we are in the data collection status, pretty much everything is in production. The County Drug Medi-cal Organized Delivery Systems and the 274 Provider Data Network for DMC ODS, we've got about 33 of those plans in production. Oh, and then ECMCS, what we were talking about today with Jeff, that's in phase 2 testing. I believe he said that as well. Next slide. So now we can get to the questions, and I will scroll up and we will start hitting some of the ones that have either not been hit, or if they trigger another question for you, you may post it and then we'll get to it right now as much as possible. Okay, I'm scrolling all the way up to the top here. All right, let's see. And folks, you can just hit it when you see it if it's something that we need to ask or talk about. All right, so yes, we know that the sound quality was a little bit choppy. We'll work on that, as Jeff said. Let's see. We will be publishing pretty much everything that you just saw. And let's see. Test sins in the past, should we continue to use the test sins for testing? And Jeff said yes. So there's a lot of answers in here already. Let's see. I'm looking for anything that has not been answered. The documentation center link is in there. Latest version of 837 INP. Was that in here? Okay. We answered that. And Christopher, we got your answers. Are there plans to allow the use of real sins for MCPs to use in the test environment? I believe no. Let's see.
Dale, sorry, Amy, I'm just gonna jump in on Dale's last question.
Go ahead.
Is the schema changing for PCPA? I don't think it is at this time. And actually, when the MCPD file and the PCPA files were first implemented, they were combined into a single technical document, which I think has been a little bit confusing. So yes, we did recently change update the schema for the MCPD file, not for the PCPA file. We may end up putting those in two separate guides just to avoid confusion. So thanks, Amy. Just wanted to touch on that.
Had a question from Dylan Clements. As a third-party submitter for a number of plans, are there instructions for who we need to contact in order to add new plans to an existing submitter? For our subject matter experts, have we covered that with any of the emails or contacts that we've already listed as our resource emails? Or is that something that we should take back and look for somebody for Dylan?
I would say that you should work with your have the healthcare plan, work with their contract manager at DHCS,
Yeah.
and verify whether or not the list of individuals that you have to have access to the SFTP server are those that DHCS has. There's an internal process that we briefly touched on for what that looks like. There are various groups involved that kind of keep track of all the plan contacts by name, things like name, email, phone number, title, and then what sort of access that is required. So I would say the contract managers, please touch base with them. The data quality reporting unit does not manage the SFTP access. So again, the best route is the DHCS contract managers. And if you would like to know yours, you can send me an email and I can send that out to you. So thank you. Hopefully that addresses your question.
You can send it to us and we can get it to Christine too.
Oh, yes. Thank you.
You're welcome.
Yeah, Dylan, essentially what you're doing is requesting access to the new plans FTP folders so that your organization can report data for that plan. So as Christine outlines, going through your contract manager to start with is a good place to start. After that, we can look at getting the correct access to the new folders. So.
And then another question from Abdul. The test SINs, are they in the documentation center?
Yes.
All right. I just wanted to clarify. And then, and there you are, you clarified it. Thank you. Here's a question. Since long-term care is new to us, and I don't think we ever received a long-term care claim, does DHCS provide how a long-term care claim or encounter would look? And so are there examples of types of claims for folks who are accessing the documentation center? Is that something we have?
Well, we don't.
Yeah, go ahead, Stephen.
All right. Well, we don't really have anything like that. If it's an encounter, it just follows the X12 format, and it's just it's a regular encounter. As long as it's coded properly, then that should be enough. Just needs to be coded as what it is.
Thank you. And if you have any more questions, you can go ahead and email us and we'll get it to the team to see if we can get you some more technical assistance.
I would say, reference your X12 implementation guide, that your plan purchased, and also the companion guide, and, work out how that long-term care encounter needs to be coded and the data filled in appropriately, and it should be fine. It's just like any other encounter. As long as it's coded properly, then it should go through.
Thank you. Did we cover Dale's question about the average testing time frame?
Average testing time frame?
Yeah.
I've had testing go as short as a week. I've had we had a plan do testing that took a year, and that was not a pleasant situation. But we like to keep it at about 2 to 3 weeks. This way, a plan gets their testing completed quickly. They can start submitting production data right away, or they can start using the new system right away if they have a new system, that kind of thing. So 3 weeks, and let us know when that file goes in. We can test it within a day or two, and then we move on to the next file. It really is up to the plan. We're not going to be the holdup. We're not going to not validate. for a while. We're going to validate them as quickly as we can get them, especially since we're going to have multiple plans coming in. So it's up to the plan. How fast can they develop their next file? How fast can they run it through the system, fill out the tracker, and get it to us? If a plan, I've literally had plan do submit a file, get the EVR, fill out the test tracker, send it to me. I test it, let them know it's good, and then the next day they submit the next file. And that type of cadence, boom, 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 and we've got it done within a week. It was amazing. And you know, they were using a contractor. They were, you know, some of the contractors we have a lot of experience with. EdFX, Visibility, and there's some PMBs. I think there are no PBMs, PharmaStar, you know, contractors like that. And we will work with contractors. We require that the health plan is always present, whether it be phone call or email, but we will work directly with contractors as well. And you know, we want to get them done as quickly as possible.
Thanks, Stephen. We had a question about the transcripts being sent. We will send out a notice that everything's available and published on the web. And so that DHCS webinar page will have the transcripts in about 2 weeks. Everything has to be approved through our system of review to be published on the website. And then we may have to tweak a little bit of the actual presentation for ADA compliance. So we do a lot of that after the fact, and then it goes through approvals. But those transcripts should be available as soon as the slide deck's available. See, again, you can put your questions here. If we don't get to it in the next 9 minutes, we will absolutely be hitting it from a FAQ response or making sure that your question has been answered directly as specific. Does testing apply to PACE plan? Looks like it.
Absolutely, yes. PACE plans, managed care plans, they're all required to do validation testing. If you're submitting encounter data to us, then yes. You know, we want to make sure you can do it proficiently, accurately. So yeah.
Did we cover Christopher White's question about the validation rules DHCS uses to validate the ECMCS JSON exchange? Because you didn't see it in the guide when you looked. So I'm scrolling down to see
we'll
it.
have to look into that and see if we can follow up with Christopher offline in more detail, because as far as I know, the requirements for the data and the data values, which is basically what the validation is, that's what the technical document outlines. But we can work with Christopher to help him understand that and to clarify, to make sure we are answering the question correctly. So making note of that. I think it was Christopher, or it might have been Skylar, but yeah, it's Christopher. Okay, yeah, we can follow up with him.
I'm scrolling down because I believe there was
And
a
Amy,
dental
can I add something?
Totally.
I know it sounds scary. This whole encounter data validation testing thing, it sounds scary. It sounds like, oh my God, we will help you with it. We will help you get ready for it. We'll help you understand it. And if you can build an encounter file, it's really not scary at all. It's just putting together a file, putting it in, we take a look at it, we tell you, yeah, it looks great. So it's really not scary. It's as long as you can build a encounter file, which we all have to anyway. CMS is in charge. So as long as you can build an encounter file, then not scary. And again, we will help you. We can't help you build the file. We can't give you the exact details on everything unless, you know, if you do have denials that you don't understand, yeah, send them to us. We'll help you figure it out. If not, then we will rely on the PACES people who are the absolute technical experts on that part of it. But we'll figure it out. We can't help you build the file, but we can sure help you get through the process.
The other question, I did find the dental question. Will dental be transitioning to JSON? Anyone? Anyone?
I believe that's about the SRF file
Yes.
transitioning in JSON. I think probably more information is going to have to be shared on that. It requires some coordination with the dental division as
Okay.
well. So there will be some follow-up on that. Z, I would suggest emailing this question to EDM Data Support so that we've got a way to get back to you and can follow up and give you a good answer on that question. So if you don't mind, EDM Data Support at dhcs.ca.gov, and that.
We'll put that in the link for you.
Okay.
Or not the link, the chat. We'll put that in the chat. Jackie Liu said, will DHCS send out an email to plans regarding the PACES SFTP testing timeline?
Yes, so I think the goal, and again, Konstantin and Stephen are really they've done a wonderful job trying to streamline the process for testing process. And I believe, so someone else had a question of this in chat as well. And we would like to return to kind of a quarterly testing period. So know if you have the first half of the month versus, year, first half of the year versus second half of the year, to have more of like larger group testing. So for instance, there are quite a few PACE organizations or PACE plans that are expected to onboard in July of 2024. And rather than doing kind of like individual one-off testing schedules, we would, it would be easier for like our staff. Again, it's limited size. It's just Stephen and Konstantin that are managing this. You know, we would ideally like to have all of those plans. You know, we'll review the testing schedule, the test criteria kind of all at one time. And then we can commence testing. Not everybody has to finish at the same time, obviously, but it's just knowing that, hey, our team will be a resource. We're going to, you know, anybody who needs to do testing during this time period, this is when we will be doing it, if that makes sense. And yes, we will let you know. We'll send out an email communication to the plans as well when we would expect to start it. So yeah, I mean, it's May 29th. So yeah, it should kick off soon.
Folks are adding a little bit to the chat. If you do have another question, we have about 3 minutes left. Otherwise, we're happy to let you go. 3 more minutes to your day. And we appreciate you all joining us. Again, if you go to the webinar page, you'll have a lot of the contacts that we covered today already available to you. A lot of the information is also in the FAQ currently from the previous encounters presentation. And we will be adding, as Stephen said, to the FAQ page, as well as posting everything you saw today. Thank you so much. Again, next month is another webinar, and we will see you then. Take care.